There are a lot of myths when it comes to plastic surgery, so we are bringing in the experts to sort things through. So we welcome Dr. Bam Gayaran, the professor and chair of the Department of Plastic Surgery at University Hospital. That means that's the guy in charge, right?
Yes, David.
So you know the answers. So
I'm going to try.
Okay, so when do people start thinking about, or when should people start thinking about maybe some rejuvenation surgery?
David, the earlier we attend the rejuvenation, the better. The results are more pleasing, more natural, less chance of complications. Those of us who specialize in the face area, the rejuvenation part of the face, recommend surgery somewhere between 35, 45. And as soon as we are seeing the changes, and this again, the results will be lasting for a very long time that way.
So if you get to it before you have a big problem, it's a little problem to fix, it lasts a lot longer.
It's not to say that it is wrong to do surgery at age 70, but we get better results again, more lasting results when we do the procedures at a younger age.
Well, sometimes they make jokes about those people in Hollywood. It looks like they're in an 80-degree window, 80-mile-an-hour window out the car. You know, their face is so tight and all that. So maybe they waited too long, or that's
they waited too long, and they had too many procedures within a short period of time. And we try to get away from that. I actually advocate to the plastic surgeons not to do too many procedures like that.
What's the most popular procedure now?
Fat injection probably is the hottest procedure in the plastic surgery, because part of aging is loss of volume. And we need to restore that, but the fat also contains stem cells, and the stem cells have the power to rejuvenate the skin and give the glow, natural glow that exists in a younger age that we cannot restore merely by surgery alone. But combination of surgery and fat injection is producing results that are extremely gratifying.
So people have like lines like I do, like here or here, that you would put fat into those lines?
Person's own fat, yeah, most of the time. Although we can use the fillers to correct that as well, but we get more permanent results from the fat injection. Also, again, fat contains the stem cells.
Somebody comes in and they say, I know I don't look the way I want to look, or I don't feel the way I want to feel, because if I look better, I'll feel better. Can you help them decide what they should do to make them feel better and look better? Or do they come in and tell you exactly what they want?
No, that's our job. But I think we are actually in a much better position to advise the patients wisely and thoroughly when they ask us our opinion, rather than telling me, this is the only thing that I'm concerned about. Obviously, what they are concerned about is extremely important to us. But on the other hand, if they ask our advice, we can guide them properly, and they will get the most pleasing outcome from the surgery.
Yeah, because sometimes they fixate on something and the problem might really be something else.
Exactly.
Yeah. So we're talking about the way a person looks and make them look better, but you also have something to make people feel better, like people suffering from migraine.
Yes, this is something that I've been working on for 13 years, and actually the procedure now is being done internationally. But we're working on improving our results, and we're doing studies on how we can make the patients have better results and fewer risks. For that reason, we're recruiting patients to participate in the study. But it is a standard of practice now, and is being done across again, in a global level.
People who suffer from migraine is a terrible, terrible thing.
Yes.
Also, people lose weight. When they lose weight, their face, will it go back the way it's supposed to be, or do you have to help them with that too?
This goes back to what I was mentioning earlier. Part of the aging actually is volume loss, and if somebody loses a lot of weight,
there's the fat.
They're going to, the fat is gone, and they're going to look older. So what we do is tighten the skin and add the fat to the targeted area where it is important to have, like in the hollowed lower lids and the creases, or around the lips.
And could you find a donor for my double chin if I give it up?
Yeah.
It's good to see you.
Great to see you, David.
Thank you very much.
Yeah.
Hey, we have a whole lot more New Day Cleveland right